Matthew, thank you for spreading awareness, and I hope this video reaches a broad audience. Mild autism, also known as Autism Spectrum Disorder Level 1, ASD Level 1, is a term used to describe individuals who display some of the typical traits of autism but to a lesser extent. They require minimal support and may be able to conceal their symptoms. However, they may face challenges in social interactions, interpreting social cues, understanding body language, and deciphering facial expressions. Due to the subtle nature of these symptoms, mild autism often goes unnoticed during early intervention screenings in childhood. Consequently, individuals with this condition are often diagnosed later, potentially in adulthood. This article examines mild autism in adults and children, discussing its indicators, its tendency to be overlooked, and how it can eventually be identified. It is important to note that mild autism is not an official clinical diagnosis but rather a commonly used term in informal language to describe ASD Level 1. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, outlines the criteria for ASD Level 1. This level is characterized by challenges in social interactions and communication, repetitive behaviors or interests, and restricted behavior patterns. However, individuals with mild autism display these symptoms to a lesser degree compared to those with more severe forms of autism. Social difficulties are common in people with mild autism, including struggles understanding social cues, interpreting body language and facial expressions, and forming and maintaining friendships. They may prefer solitary activities or have limited interests. Although individuals with mild autism may possess functional language skills, they still face challenges in using language effectively for communication purposes. This can manifest as difficulties initiating and sustaining conversations, comprehending sarcasm or figurative language, and navigating the back-and-forth nature of social communication. Additionally, individuals with mild autism may experience sensory sensitivities similar to those observed in other forms of autism. They might be hypersensitive or hypersensitive to sensory stimuli such as light, sound, touch, or taste. These sensitivities can significantly impact their daily experiences. Mild autism often remains undetected or is diagnosed later in life, even in adulthood. Signs may be subtle and easily overlooked, mainly if individuals have developed coping mechanisms to mask their difficulties in social situations. It is crucial to identify and intervene early to provide the necessary support and interventions for individuals with autism spectrum disorder, ASD. Concealing symptoms. Some individuals with mild autism may adopt strategies to cover or compensate for their social and communication struggles. This can make recognizing the condition even more difficult, as they may appear to function relatively well on the surface. Treatment and support. While individuals with mild autism may require less intensive support compared to those with more severe forms of autism, they can still benefit from customized therapies and interventions that cater to their specific needs. Behavioral therapy, social skills training, and speech therapy can address their challenges. It is crucial to keep in mind that each person with ASD, even those with mild autism, possesses distinct qualities and struggles that can significantly differ. By identifying the condition early on and providing suitable interventions, individuals with mild autism can enhance their quality of life by acquiring vital social and communication skills. Suppose you suspect that you or someone you are acquainted with may have mild autism. In that case, it is imperative to seek an evaluation from a healthcare professional or specialist as a vital measure towards obtaining a diagnosis and accessing the essential support and resources. Matthew, a cancer and stroke survivor, requests you help spread awareness.